Hi there, I'm Erin Shador from Tri-County Dental Clinic. We are here today to show you our brand new dental bus, which we purchased with the help of the Nelson Family Fund. This dental bus is used to travel to the schools in the Tri-County area and provide free dental care to the students in that school. And with me today, I'll let them introduce themselves.
I'm Jeff Buckton, the Executive Director of Tri-County Dental.
Ann Engelhard with the Community Foundation.
And Kurt Dachin with the Community Foundation.
And now we're going to take a tour of the inside. Great, okay. The first thing that I'm going to show you guys is one of the really great features of this. This is one of the best things for the staff. It used to take a good 15-20 minutes to set up and take down the bus every day, and this has an automatic startup. You push a button and it does everything for you. You don't have to do anything. Just stand there and let it do what it does. Then these are the chairs that we use for procedures. We have 3 operatories, 2 in front and 1 in the back. We can do pretty much any procedure on this bus that you can do in a conventional clinic. So we will have dentists doing exams, we will have assistants taking x-rays, and we will have hygienists doing cleanings, and dentists doing extractions and fillings, all while the kids get to enjoy a movie at the same time. We have cars playing right now. So again, everything is done right here. We can go to the schools. Parents don't have to take off work to bring their kids to the clinic. This is truly a blessing for our clinic.
Can you tell us about how many students a year you're able to service through bringing the bus to the schools?
Sure. Yeah, we actually have about between 2,000 and 3,000 kids each year participate in the program. And that's from start to finish, typically from the screening all the way to restorative work at the end.
So when they come into the clinic, or when they come onto the bus, usually they're kind of like an exploratory exam, and then you decide if they need more work, or how does that flow?
Yes, phase 1, it is a 3-phase program. So phase 1 is just a screening, which we typically do inside the school. They set us up with a table and chairs. Kids come through and a hygienist just takes a look to see if there's anything urgent that needs to be taken care of right away. If we do find anything urgent, then we call the parents that same day and try and get them into the clinic. After the screening, we set up the exam day where the dentist comes on, does an exam, a complete exam, and the assistants take x-rays so they can diagnose any cavities that aren't seen by the hygienists. And then after that, we come back for a couple of days and the hygienists see kids for the cleanings. And then at that appointment, they are sent home. The kids are sent home with not only toothbrush, floss, and all of that stuff, but a note letting the parents know what they found and what needs to be taken care of. If they have restorative needs like fillings, extractions, we schedule the bus. Normally that happens on Fridays. We have a couple of dentists who are willing to come out and do all of those procedures on the bus, and we get those fillings and extractions done.
Wow. And what's the big difference between the new bus and the older bus?
Oh, what isn't a difference? This is just, it is so beautiful to look at, first of all. This color scheme is just absolutely perfect for us. The chairs are so much easier to set up and take down. It's very quick, and things are just done for us right now, which in the past we would have had to take time out of seeing kids to put up and take down the bus every time. So it is really just wonderful to see all of the changes and all the features on this bus.
And what has their reaction been to the new bus, and kind of how they're able to do their job?
Right, yeah, there's a lot more room on here than there was on that old bus as well. Just this walkway here is probably a foot wider than we had on the old bus. So they're able to move more smoothly between patients, because when we do exam days, we'll see sometimes 80 kids. On one day, the dentist will go through and do exams on 80 kids. So they're moving between rooms, and having that extra space is really helpful. They've really been happy with the changes.
That's good to hear.
Yeah. As you can see, we have all of the equipment here on each of the operatories that you would need to do any procedure that you would do in a conventional clinic. The lights, the water, all of the stuff is right here, easy access, and it stows away very nicely to make it easy to drive as well.
And tell me a little bit more about the video screens. Is that something that the other bus didn't have?
Correct. Yes, this is something that's brand new, and we have some little kids that come on here, as little as sometimes 4 or 5 years old. So to give them something to distract them from their procedure, it has been a big blessing.
Very cool.
Yeah.
And this driver's console, this is pretty cool.
It is,
You can
yes.
pretty much go anywhere. Where are some of the places that you go physically?
In addition to the schools, we also visit places like COTS, Harbor House, the Ryan community. We've been to food pantries, and Boys and Girls Clubs as well. Those are some of the locations that we go to in the summer. And then when we have time throughout the school year, we also head to those places as well.
And you say that like per visit, you could see quite a few kids. I mean, if there's
Yeah.
3 chairs.
Yes, absolutely. 3 chairs, we get a lot done each day, but up to 80, typically 80 kids for an exam day. They normally get through about 24 on hygiene days, and then they'll get through typically 12 to 15 when they do extractions and fillings. Those are a little bit longer for procedures.
Is there one procedure that might be maybe a little bit more difficult than others that you would do right here on the bus?
Well, typically, probably, I would say extractions and fillings are the most difficult here on the bus. They can be pretty in-depth, and especially with children who have a tendency to be a little more fearful, things like needles and stuff like that. So that's, again, why that screen and the TV screens have just been really huge for helping to distract them from what's going on and make sure that we can get the necessary work done.
And these are kids who might not otherwise have access to dental care. Can you
Right.
talk just a little bit about that?
Sure, yeah. To be eligible for the program, children have to be eligible for the free and reduced lunch program at their school. So typically they are coming from lower income families who probably do not have dental insurance through an employer and can't afford to pay out of pocket for things, even things like cleanings, which can be about $200 if you just go to a dentist and pay out of pocket. So these are the children that really need the care the most, and we're so happy that we're able to help them. Thanks again to the Nelson Family Fund for your help in purchasing this wonderful new bus.
On behalf of Tri-County Dental, all of our donors and volunteers, and all of our young patients, we want to thank you for your donation and thank the Nelson Foundation for their donation to this bus.
Oh, wow. Beautiful. Take a look.
Wow.